They're 6. So our story was a little bit different, and like I said, they were conjoined, and I found that out at 18 weeks. We didn't know what they shared, but in all the ultrasounds while I was pregnant, they could always find baby B's bladder, but they could not find baby A's bladder. And then toward the end of my pregnancy, they thought they found baby A's bladder. But once they were born, we found out that they didn't, and they shared their colon and their bladder. And so at 2 days old, they were separated by Dr. Kropp, was one of them. And they basically just split in half their colon and their bladder, so each twin has half. And fast forward a whole lot of learning and parenting. These are our only kids, and so we were kind of thrown into parenthood in a different way that most people are. So I think that one big thing was knowing to the extent of how traumatic introducing a catheter may be. I think that that's something that we've kind of struggled with for several years now. Just introducing them to what their life is going to be like using a catheter for their entire lives. And I really didn't account for that aspect. I think physically, having great doctors and a medical team, we have that, and so that's been very fortunate for us, but just the mental part that comes with trying to explain to your kiddo, like, this is how your life is going to be. I think something that we got really lucky with Dr. Kropp is knowing that this is something like that he's an expert at, and I think that provided us a lot of relief, knowing that this is something that he focuses on. This isn't something that, you know, he just kind of does sometimes. This is something that he's spent years and years and years doing. So I think it's really important to find a team that you can trust, that they have the experience, because there's been stories that I've heard that of kiddos that have bladder exstrophy and cloacal exstrophy that didn't find that team, and they made some decisions early on that affected future surgeries and what could have been done differently in the kid's future to provide maybe a better outcome. And so I think that's really important to ask your team their experience and how comfortable they are with their knowledge on bladder exstrophy and cloacal exstrophy. So something that I've come across is, you know, when they're sick, or when I have to take them to the doctor that's outside of Dr. Kropp's office, it can be kind of a challenge, because, you know, if they have a UTI or, you know, something like that, and the physicians at an ER or somewhere want to do, you know, a urine test, I've been challenged. Well, we just don't know what to do. You know, you as a parent, you're thinking, well, you're the doctor. Like, this is something that you should know. So don't hesitate to be like, okay, this is something that we do. I'm more comfortable cathing my child than you. You know, and so, because you want your child to be confident and not worried and things like that when someone new. And I've run into that several different times in the last 6 years, that, you know, it's not something that they see every day, obviously. So just be assertive sometimes, and that's nothing to be ashamed about. You know, I've challenged many doctors, and as a parent, you might think, well, do I have the authority to do that because, they're the professional? But, this is the life that you and your family live. This is the life that your kids live. This is something that you see every day. And so I think it's important to know that, your voice matters. That's something that I've done at an early age, is just for them to accept themselves as they are. And I think talking to your kiddo about the fact that they have differences, and but that everybody does. As adults we know that, and it's something so important to teach your kids. I've almost done so well that they're kind of nervous to make any changes to their body that they have right now. So I may have overcompensated a little bit, but I think it's so important that they accept themselves, and they know that whatever decisions we make for them with their doctors, that they make for themselves, that it's to give them a better. I don't even like to say that. Let me rephrase that, because I don't like to say a better life, because kids that have cloacal and bladder exstrophy can have a great life. It's maybe one that can help them to be a little bit more healthy, I guess is what I'm trying to say, because I would be so offended when they were first born, and I would have family or friends that, well, man, their just life isn't going to be the same, and I'm thinking, but it can be. It's our responsibility to teach them that they can do what they want to do. It just might be in a little bit different of a way. As a blanket statement, that mental health is just so important. I think that everybody can benefit from it, and especially when, you're facing something that isn't common. And as our family, we obviously, my two kiddos are the only ones that have bladder, well, they have cloacal exstrophy, but, it's a small group, right? And so it's not like they have friends. They have each other, which is awesome, but they don't have their best friend that has it, or a parent. And so providing them with an opportunity to speak to someone about how to handle their feelings, how to handle their emotions about upcoming surgeries, or being scared of a catheter, or just the differences that they might run into with having exstrophy. I think that's so important, and it's been so helpful just to see their progress, even from as simple as going in for an ultrasound. They would cry and they would be so worried, and it was just an ultrasound. And as a parent, you can't really understand what that's like, being 2, 3, 4 years old and having this, camera looking around. And so from those years and seeing them today and going into have a regular ultrasound, and them just talking through it and laughing and just being able to be, that's so important, and it gives them a platform to have when they go to other surgeries or other appointments, and it's just something that I think is super important. My name is Khalie, and my girls are Heartland and Everly, and they're 6.